Thank you, everyone, for tuning into our clinical conversation today. We today have Sarah Rollins with me, and I actually know Sarah from my grad school days. We graduated together, and Sarah is going to talk to us about somatic therapy and some of the work that she does. So we are so happy to have you here today, Sarah.
I'm so grateful to be here.
Yeah. So I will go through a little bit of the CE criteria, and we want to leave enough time for Sarah to tell us about what she does and what we're here today to talk about somatic therapy and how this informs her work. She owns her own private practice, which we'll talk about in a moment, and how she kind of got into this work. So a little bit of background. My name is Megan Mitchell. I'm a LICSW, LMSW. I'm licensed in multiple states. So depending on where you are, I'm a clinical social worker. And I work with child and adolescents. That is primarily my area, my population. I'm the owner of Brain Space Wellness, which is a private practice. And I'm working towards my play therapy credential. That is almost through. So that's exciting. I'm the founder of Agents of Change Social Work Test Prep. And then obviously we have moved now into providing continuing education content for all mental health providers, which is really exciting. Some of my interests, I have many, obviously working with kids and adolescents, play. I work a lot with neurodivergent kiddos. And then I'm also a DSW candidate at SUNY Buffalo. And I'm looking at different topics there, include technology, supervision and ethics, cultural humility, and supervision and consultation. So that's just a little bit about me. I'm going to read to you more about Sarah so we can get to know her. This is Sarah. Like I said, we know each other from our time together in our grad program. And she has been in the field just as long as I have because we graduated together. So she's a seasoned psychotherapist and the owner of Embodied Wellness. She owns her own group practice, specializing in online therapy for adolescents and adults in Michigan. She has experience in somatic experiencing, EMDR, and internal family systems. She focuses on treating trauma, PTSD, depression, and anxiety. Before she did this, because we knew each other way before we both entered into private practice. She worked in a variety of different clinical settings, including psychiatric social work at the University of Michigan Health System, and a school social worker at Clara B. Ford Academy. So she was doing some school stuff too when I was. She has a background in multi-systemic therapy and foster care and has a broad skill set for supporting individuals facing complex mental health challenges. When you've gotten this long and far into the field, we've really seen a lot of things and done a lot of things. Some things that are really important and some values that are important to Sarah. She's deeply committed to providing inclusive and trauma-informed care, focus on supporting BIPOC and LGBTQI plus communities, and her practice reflects her dedication to helping clients achieve personal growth and healing through innovative and compassionate therapeutic approaches. So that's her background. It's very extensive, but we are going to pick her brain here in just a moment after we get through our objectives, and we can hear all about how she got here, where this journey began, what she does now with this work. So why is somatic therapy important? I feel like people have probably heard this term thrown out there. It's becoming more in the space, which is great. Why is this important? It addresses the connection between mind and body. We'll talk more about what that is. And you hear that a lot, right? Like this mind-body connection, we know there is a connection. And we're going to talk about somatic therapy and how people can be more in their body, incorporating physical sensations and how trauma is intertwined with this. We'll talk more about the intersection of this. Trauma-informed care. That is really essential to the work that we do, but somatic therapy is very, very effective for working with trauma. And we will talk about what conditions, what different ways that Sarah uses it, what might be some clinical presentations that she works with that this has been beneficial for. And then integrating this is important. So it's important that we know what it is. We want all our therapeutic services, our clinical work to be inclusive, personalized, and we want to improve outcomes for diverse populations. So we might touch on that a little bit too, like how is this an inclusive practice for everyone? So that's why it's important. And then our learning objectives for today, why you're here for your CEs. Participants will be able to explain somatic therapy techniques. So what this is, and we'll talk about how Sarah uses it, what other therapeutic modalities pair well with it. Apply trauma-informed practices. We're going to be talking about trauma in the work that Sarah does, and we're going to be talking about trauma work, and then enhancing the therapeutic presence. So what does it mean to offer a safe and supportive environment? What does it mean to help clients understand the mind-body connection to ensure that they are going to heal and get the support that they need? So without further ado, we're going to have our nice little chat here with Sarah. So Sarah, welcome. We're excited to have you here. Why don't you tell us just a little bit? I kind of gave the background, but a little quick bio about yourself and your work that you currently do.
Yeah, awesome. So excited for this conversation. So yeah, like you said, I'm Sarah Rollins. I'm a clinical social worker and somatic experiencing practitioner, and I can talk a little bit about what that means. But I currently own and I'm a therapist too at Embodied Wellness. We're a virtual group practice in Michigan. So our specialties are really focused on somatic and EMDR therapy. So we really like to focus on the holistic aspects, the mind-body approaches to trauma. Of course, we integrate all types of treatment with trauma, DBT, CBT, traditional talk therapy, but we really know and believe that trauma is stored in the body, not just the mind. And also the mind is part of the body. We don't want to just say that they're separate. So that's really what my focus is now. And I love doing these conversations because in Michigan, there's not a lot of somatic practitioners. It's more common in other parts of the country. So it's really great to have these conversations and spread the word.
Yeah, and we were just talking before this. I now am in Michigan, but I was in DC, and I was like telling Sarah, I was like, "Oh, it's I hear it a lot more." And she was like, "That's interesting because in some parts of, the nation it's not necessarily talked about so much." So I'm so happy that we have you here to talk more about it. And so you've done a lot of different things, right? You've worked in hospitals, you've worked in schools. How did your journey towards this niche come to be? How'd you get here?
Yeah, such a good question. And I actually think it's important to talk about because social work and I think a lot of the helping professionals are really broad. And so when I first started, I did multisystemic therapy. So I did in-home therapy. I survived a year. It was very hard, very rewarding. And then I moved to school-based. And so I worked in a unique school situation where all of the students were adjudicated, meaning they were court ordered to be there. They were at a girls' residential facility. So both my first year and then my second and third year, because I lasted at the school for 2 years. So those were really focused on trauma and understanding trauma with youth and families.
Awesome.
And oh, I'm sorry.
I say, and then you went to the hospital.
Right. And then I actually started to work with substance use,
Okay.
which so I worked at an outpatient clinic in a hospital setting. So I did a lot of substance use and co-occurring disorders. And what I really saw there is underneath the substance use was a lot of mental health concerns, a lot of unresolved trauma. And so when I parsed apart that, not only myself, but my clients realized, hey, these tools that you have are so helpful. And what I mean by tools, I mean my cognitive behavioral tools that I learned in social work school were really helpful. And they only went so far.
Mhm.
And so my clients were noticing that, and I was noticing that. And so I actually started to feel kind of helpless. And so that's where I actually started to talk to other social workers and realize that there's other techniques out there, not just kind of the classic ones that I learned in school.
Right. And I remember taking CBT based courses, DBT, those type of things. And um I like to say I'm very prescriptive now, so I weave in lots of different things. But if someone is just listening and they're maybe new out of the field, they're probably like, I am a CBT provider, I am a DBT. And you start that way because you do have, niches or stuff that you learn. But as you start to be in the field more, you realize that maybe I need to have some other modalities that I can weave into my work so I can be as effective as possible.
Yeah, and I think for me, that's really client-centered or person-centered, is that um, not every person is gonna respond to every treatment, and that's okay. And sometimes it's the way I say it, sometimes the way I introduce a concept, and sometimes it's truly the concept itself. And what I have to be knowledgeable as a provider is that it's not about the client being wrong or there's something wrong with them or something wrong with me. It's just that everybody's unique, and that's amazing. That's why we work in this field. And so what's really cool is by gaining more knowledge, then I always say the knowledge is the DBT or the CBT or the somatic therapy or the IFS, whatever it is. And then the wisdom is integrating all those techniques with the person in front of you, who they are in that moment.
Right. And it really is an art. And I tell people, you could be trained in every single thing. That doesn't make you good at being a therapist, right? There's so much more that goes into it and knowing what being attuned to your client. So, I always like to ask that question first, how did you get here? Because it always is some sort of journey that people were on to get where they are today. So, let's start with the basics. Can you explain what somatic therapy is if someone is new to this or they're like, I kind of have heard of it, but I'm not really sure. So what is it? How would you explain it?
Yeah, it's really important, this question. So somatic therapy is a broad term for therapies that integrate the body into treatment. That's my basic explanation. So I'll get a little more into the nitty-gritty here. So the way I describe it is traditional talk therapy or traditional cognitive therapy really focus on thoughts, feelings, and behaviors.
Mhm.
And those are really important. Yeah, the CBT triangle, right? I never ignore those, and we don't ignore those in somatic therapy. What we're doing in somatic therapy is we're really focusing on the effect of the nervous system and the present moment in our experience. So we're integrating sensation. And what I mean by sensation is what's happening in my body right here, right now. We're integrating imagery. Sorry, I was going to say imagination, which can be imagery, but so imagery. So as you think about that, does any image or can you imagine anything coming up? And some people have a lot of access to this, and some people have less.
Yeah.
And that's okay. Same with sensation. And then we also look at behavior, but we look at behavior through a nervous system lens in regards to fight, flight, and freeze and the startle response, and less of how are your thoughts and feelings affecting your behavior.
Right.
Yeah.
I love that. I have done some similar work and I'm thinking, oh, maybe I do a little bit of this. In play therapy, there's a big push towards neurobiology and interpersonal neurobiology. And how do you attune to children? How do they regulate the nervous system? So I'm glad to hear that. Maybe I have been incorporating some of this stuff. And I will say, you work with adults, but kids are talking about these things. They're like, did you know I have an amygdala that does this in my body, and it's great. So I love that kids are starting to have the language to talk about these things, which tells me someone's teaching them these things, which is great.
Yeah, I've noticed an uptick in social media, and I don't know if that's part of it. I know that TikTok and Instagram and all these social media outlets have really started talking more about the nervous system, the polyvagal theory, the vagus
Right,
nerve. And so that's really great. What I really want to just caution people is that just because it's seen on social media doesn't mean that it's fully true.
right.
And so there might be elements of truth. There is a vagus nerve. Polyvagal theory does exist. Regulating our nervous system is a thing. I also named that not everything might be fully true. And so we get a lot of people coming in with partial information from social media. So I'm grateful that it's out there. And I also want to caution that
Yes.
it has some limitations.
And do your research. Work with a lot of teens and they're like self-diagnosing and I'm like, let's unpack this and where did you hear this? And we got to vet our sources here. So that there is that piece too, right? If you're questioning like, what is this? Do your research, right? There's research out there where you can see and ask clinicians and practitioners, we should do this and they're always be doing this and always be, approaching everything with curiosity, right? So I love that you said that, right? Because we know social media some people get their news from that and get their sources from that. So just be mindful of what's out there because you got to vet what's out there. So before we jump into some more of like the trauma and what some of the somatic therapy might look like, I know you and I were talking before, you're a somatic experiencing practitioner, and that is something that you have worked very hard towards. Tell us a little bit about what that specific designation means and what went into getting that credential.
Awesome. So when I talk about somatic therapy, that's that broad term, right? And then there's different types of somatic therapy. So one type is somatic experiencing, which is the designation I have. So somatic experiencing, there's Somatic Experiencing International, which is where I received my certification. Peter Levine developed somatic experiencing. He is the founder of that treatment. So if you want the true somatic experiencing training, that's where you go for that treatment. Training, not treatment. There's also a directory on that website, so you can also get treatment through that website too. So the training is over 3 years. The first level is called the beginning, and it has 3 4-day weekends. The second level, intermediate, also has 3 4-day weekends. And then the third has 2 6-day weeks. And then in that, you also need a certain level of or number of consultations, and then a certain number of personal sessions, which purely means you're getting, as the practitioner, an experience of somatic experiencing, so you know what it feels like in your own body.
Okay. So this took a lot of work and a lot of time and a lot of expertise to get here. So also something that you said, like there is a directory, because I know sometimes people throw out words and stuff. So if someone is interested, there's a directory where you can look and see who is a practitioner and has this level of certification.
Yes, it's very nice because it's so hard to determine.
Right.
Someone can say they have their somatic therapist after an hour of training or 3 years of training. So it's very difficult to decipher sometimes.
Yes, exactly. And that's part of vetting and researching, right? Like you can ask questions. I always tell people, I'll have potential clients come in and like, can I ask you questions? I'm like, please do. We like when you ask us questions. Like that's good. That shows that you're invested and you want to know. So for us as out there as practitioners, allow those clients to ask those questions. So now let's I guess change gears a little bit, but obviously you work with trauma a lot and clients who have had trauma. And I know that we were talking how somatic therapy, there's a connection, right? Mind-body connection. We know a lot of times trauma and experiences and memories are stored in the body. So how do you see this connection between mind and body, especially in clients who have experienced trauma?
The biggest thing I see is that we know logically we're safe, or we know logically the trauma is over if it is over. And we also have to remember sometimes trauma is actually happening in the here and now. But if the trauma is over, we know logically that it's over, but our body still believes it's happening currently. So that could look like a flashback. That could look like an implicit memory. That could look like a startle response when nothing is actually there. So then the disconnect between knowing logically something is over and our body reacting differently to what our brain is doing can create a lot of distress.
Mm-hmm.
And what we call it in somatic experiencing is this concept of overriding. And what tends to happen is like, well, we override our body's response because logically I know. So I'm like, well, it's silly I feel that way, or it's stupid. My clients will say that. It's so dumb. And Of course, that's negative self-talk. And we could look at it as like a cognitive way that we could look at, hey, we can decrease the negative self-talk. And what we could really see it as is that we have this language in our nervous system and this language in our bodies that are really fighting. And also our society really focuses on the mind over the body, right? And people do think it's weird if your body's responding differently to your mind in our society. So there's a lot of societal aspects that we also have to acknowledge and bring psychoed in. But that tendency to override when the mind, the body's impulses, when the mind is saying something different and not giving space for both stories.
Yeah, that's a really good, I've never heard it explained that way. So that makes a lot of sense. And I, just from my work with kiddos that have had trauma, obviously some parents too, there's oftentimes a big disconnect between the body. Maybe that was a coping mechanism, or it could be a variety of different things. Do you see that a lot in the work that you do, that there is a very big disconnect because they haven't ever given themselves the space or had the opportunity in a safe way to explore the body work?
100%. And sometimes it's for that reason, like you mentioned, and sometimes it's because of societal norms. It's not even trauma, it's that we weren't really taught to connect with our bodies. I was never taught about sensations. I think we're taught about pain. But otherwise, we're not really taught, what is your body feeling? What are you noticing inside? We're really taught about our feelings. I think kids a lot of times notice that feelings chart. Are you sad? Are you happy? That's a feeling, not a sensation.
Right.
So sometimes it's not trauma that when we feel disconnected from our body, and we have to, like you said earlier, be really curious and
Mhm.
not jump to conclusions that everything is trauma, or everything is neurodivergency, or everything is anything,
Right, right.
right? And just get curious about why someone's disconnected, or if someone's disconnected, or when, right? Because moment to moment, our nervous system can do something different. And so that's the beauty of being with someone each moment. And sometimes we're more connected and sometimes we're less. It's usually not an
Yeah.
all or nothing thing.
Yeah, that's such a good way to put it. An individual might not have ever had the opportunity to stop and take a step back and say, this is what's going on, right? Like I said, I work with kids, so I love some of this stuff. I have a book called My Body Sends a Signal, and we talk about the signals your body gives, right? Like I'll have them rub their hands together, and I'm like, what you know, what's happening? Oh, it's a little bit warm, it's a little bit fuzzy, they're getting a little bit wet, right? And a lot of times kids struggle with this because they're just like, it feels weird, right? So giving them the space to just kind of, and how do you know your body's hungry? Well, I know, right? Well, do you get something? Does something happen in your stomach? Does it make a noise? Does it feel a certain way? And it's just, I feel hungry. It's like, well, what does that mean? What are the sensations? So we're starting to see some of that work with kids, which is great because I don't think our generation and above has had the opportunity or the language or the work done that needs to be done there.
Yeah. And what you said, if I can piggyback off of that, I ask that question all the time. How do you know?
Mm-hmm.
It's not for me to, because I'm like an a-hole doing that. I'm like, well, how do you know? It's
Right.
curiosity, right? So a common question, or I apologize, a common concern people come in with and say, I'm anxious.
How do you know that?
Right. What in your body tells you that you're anxious? And I would say, if you weren't able to use the word anxious,
Hmm.
right? What tells you in your body that you're anxious? How do you know that?
Right. My heart's racing. Oh, I get prickly,
Mhm.
feeling in the back of my neck, or um my throat gets tight. I'm just giving you examples here.
Right. Exactly. And sometimes it is our thoughts. Sometimes our thoughts are racing. We have rumination because that is part of anxiety.
Mhm.
So it doesn't have to be 100% body. Remember, the mind is part of the body.
Yeah.
So, but it's, we can get so caught up in these words. I'm anxious. I'm sad. I'm fill in the blank. and not really know what that means, just as you were talking about hunger cues.
Mm-hmm.
And what I've actually noticed a lot is that we call it overcoupling. So the concept of something, two things together that shouldn't be. Like I think about salt and pepper, like those go together. But no one thinks about like salt and a spoon. Like, right? Like, or salt and a windshield wiper, right? That's like an odd combination, right? So if every time I think about salt, I also think about a windshield wiper, right? That's overcoupled. And that can happen, like, for example, why people who maybe have been in a car accident, then they go into a car and have a panic attack.
Mm-hmm.
So there's this overcoupling that every time we go into a car, panic attack together. Because again, spoon, windshield wiper, those two things don't naturally go together. And so
Right.
they're overcoupled. So that can happen with emotion, is that emotion, every time we feel a heart race, we might think that's anxiety and code it in our brain as anxiety. But what might be happening is, what other reasons might you have a racing heart?
A variety of different ones, right? But we don't think about that. Now I'm starting to think, like I would think anxiety, right? But it could be I just sat down quickly or I like went up a flight of stairs or anything, right?
Right. Someone could have spooked you, right? And like, it might not be like full blown anxiety, it might be like excitement. Sometimes,
Or I heard someone honking their horn outside the window and it a startle response.
right. So, what we also want to do is get to the sensation and help people be in touch with their sensations and see that they can be with their sensations and be okay. And I call that unpleasant or pleasant rather than good or bad, just as emotions aren't good or bad, they're not right or wrong. Same with sensations. And start to uncouple that not every time my heart races does it mean that I'm anxious or whatever that might be. That was an
Right.
example, right? Because sometimes my heart races because I just worked out,
Yeah.
right? But our minds can do that sometimes as a result of trauma.
Our minds are pretty powerful in that way. A couple follow-up questions from that. So does this, how long, obviously it's probably depends on the client, but how long or how many months, weeks does it depend? Does it take to get into this work? I can imagine it depends on the person, but um tell me about like what it might look like to engage in this work. Is it something you do every session or try to incorporate throughout? How do you know if someone's ready to even do this work?
Really important question. So, a lot of people come to me because of my expertise in this, saying they want somatic therapy. Some people don't know about somatic therapy and they get a somatic therapist and they're in for a surprise. So, I
Oh,
think
this is not what I thought.
right, like what is this body stuff? So I think one, it depends on someone just engaging
Understand.
at the beginning. Right. I will say, just because we want something, and I can tell from my own life, sometimes I want something and then I get there and I'm like, ooh, this is a lot. Be careful what you wish for. So clients may ask for something, and I'm going to say that this happens with all treatment modalities that I've ever worked with: EMDR, internal family systems, attachment theory, all the things. They may ask for it, and then once they actually get to what the treatment looks like and they're feeling it in their bodies or they're experiencing it, the nervous system, it's not that it's resistance, it's that it's too much for the nervous system and they're out of their window of tolerance. And so we don't look at it resistance. The client's not angry at you or mad or doesn't want to do it. It's that the nervous system, it's too much for it to handle.
It's overwhelmed. Yeah.
Yeah, right. So they're either above that window of tolerance, meaning they're in sympathetic activation, or they're below the window of tolerance, which they're meaning there might be in dorsal vagal shutdown. And so we don't want to do treatment for really heavy trauma processing in that, but we can still do somatic therapy in that, which is really cool. So I'm going to probably do less and really check in though. So sometimes that's why I really like to have all these other techniques, because I might have to interweave parts work, or I might have to interweave some EMDR resourcing or some cognitive work. So I will say, I think this is the same with any trauma treatment, but the more complex the trauma, the longer it takes.
Right.
For individuals who come in and maybe have done some pre-work, they already know their bodies, maybe they do yoga or Reiki or something, or they're already engaged. I would say it goes faster, but not always. I mean,
Yeah.
and faster isn't always better. I think in our society, I see all these posts about 3 steps to regulate your nervous system, and those bother me so much because the goal is not to always regulate your nervous system. If you're seeing a bear, I really don't want you to regulate your
No.
nervous system. Please don't do 3 steps. Please listen to your nervous system and do what it needs to
Yep.
do. Don't regulate in front of a bear. So, um, I I know that there's this desire to know how long it takes, and I wish I could give that.
It
I
depends.
also think it's more important to find a clinician who not just has the training, because like you said earlier, training is not indicative of everything, but someone who feels like the right fit, someone, if you need them in your insurance, that takes your insurance, like all these other things, because the nervous system might bring up stuff that you didn't even know was there, even though you don't have complex trauma. And that's okay. That's just what happens. So when we have these expectations that it's only going to take X time and it doesn't, then for me at least, I feel like I'm doing something wrong. And it's not about that.
Yeah. I tell people this all the time, especially new clinicians. There's usually not an answer, right? There might be an answer because insurance stops paying, and then we are like put up against stuff like that. But that doesn't mean that the work is done, right? Like, or maybe life got in the way, so they have to put things on hold. So it depends. It really depends. Um, so that leads me to my next question. We talked about trauma-informed care. You do a lot of trauma work. How do you build trust and safety with clients when doing somatic therapy? What does that look like? What does that mean? And is there a level where they have to trust themselves?
Such a beautiful question. So one of the first things I do is I provide psychoeducation about me, about what I do.
Mhm.
I do a couple different things as a somatic therapist that I learned that I never learned in graduate school or any of my other training. And so I can share those things, but I also tell them up front that I'm going to do those things and ask for permission.
So transparency,
Correct. And
consent.
choice.
Yeah.
Not just transparency. I'm not going to say I'm going to do this. I say, this is
Okay.
my, yes, right? And not only is it okay at the beginning, because we can provide informed consent at the beginning. And then once we get to that, it might be like, ooh, no, no, no.
Mhm.
Right. So I consistently, re over and over again, do this. And it really helps, I hope, build trust, because part of trauma is not having choice, lack of autonomy. So what we do is we try to repair that, at least individually in session, relationally, and then hopefully people can then start to build trust in themselves,
Yeah.
externally, and in the right places. Because sometimes what we want to do is know that we shouldn't be trusting everybody and everything. It's not black and white. And so I always say, please don't take my word for it. I am not a guru. I am not a god. So I am not here to say you have to do this. Let's figure this out together. If you'd like, let's experiment together if you'd like and see if this works for you. Rather than, hey, I'm telling you to do this. This means you have to. And noticing our power dynamics, because that's important in this therapeutic relationship, that I do have a power dynamic. I am being paid, right? I have an expertise. They're coming to me for help. And so I'm not trying to exploit that, but I do think it's important to acknowledge it and do our best to like name the elephant in the room,
Yep.
dilute
Yeah.
it as much as possible, but also know it's there.
And just by naming it builds that sense of, hey, they're being upfront, they're being transparent, they are doing what they say they do.
Yes.
So that I love that you answered that question that way. And I can imagine, I've worked with trauma. I'm not a trauma expert, but I feel like throughout 12 years, definitely it's come up. Is I like that you said by trusting the process, trusting you, trusting the environment, they start to build trust in themselves. Because with trauma, how much is I can't trust anything because these things have happened. So that is a huge piece of it, is trust with others, trust with self, trust of the environment, trust of everything.
And I say, you shouldn't trust me inherently. Please don't. Let
Sometimes
me
the
think.
opposite, right? People are too trusting.
Yes, that can happen, right? Sometimes people don't trust anybody as a result of trauma, or they're too trusting. And so what I really want is for people to, how do you know I'm trusting? It goes back to that question. What tells you I'm trusting? Well, you show up for a session every week when you say you do.
You
Well,
follow.
when you, yeah, right? When you say you're going to send me a resource, you do. You listen to me. You remember the things that I'm telling you week to week. You remembered my dog's name.
Things that we as clinicians, it's part of being doing good clinical work, but they matter. They really do matter.
Yep.
Yeah. I love the stuff that's coming up. So a couple other questions. What role do you play in this? So you have this expertise, but you're not in their body, right? You're in your own body. So what role do you play in facilitating, or what does it look like that you do? And then do you have to do any managing your own stuff too? Because stuff probably comes up and sensations come up in your own body. So how do you manage that?
So important. And I will say before this training, it also came up in my IFS training. Before I did the IFS inner circle training, and it came up there too. So I would say in somatic experiencing and IFS, this is the only time that I was taught to notice my own nervous system. And
Mhm.
in IFS, they call it self.
Okay.
So you can call it whatever you want, spirit, self, witness, body, whatever. So I'm going to go into that first. It is so important as the clinician to notice your own nervous system. I have clients that when they get really anxious in their sympathetic activation, I notice for me, I can also go there. Yeah. And then what happens? I want to fix it. I want to intervene. I want to solve their problems. I also have a client, this was way in the past before I did any somatic work. I would yawn so much in her session. And she even noticed, she was like, why do you yawn all the time?
Bored with me, right?
And I felt so bad. I would drink caffeine, I would chew gum, and like, I don't mind drinking a little, but I had to stay awake. I could not stay awake. And what I noticed actually through my somatic training was that our nervous systems connect. And we know that because of yawning, right? Like if you yawn, I yawn, same thing.
Ages. Yeah.
Right. So we call that resonance, where
Hmm.
our nervous systems connect and play off of one another. And so it's my job as a therapist to do the best I can. And I'm saying that moment to moment. Sometimes I get caught up. I've had clients where all of a sudden I'm dissociated. And then I
Mhm.
say, are you dissociated? And they're like, yeah. I'm like, cool, me too. Okay, let's come back. Right. So it's our job to the best we can, because we're not perfect, to notice what's happening in our body and then get curious. Is that because of resonance? Is my client dysregulated? Because what ended up happening with this, the reason I was yawning is because this client had a lot of dorsal vagal shutdown, meaning she was very kind of depressed. Her nervous system was in the shutdown state. And so that was playing out in my nervous system, but I just didn't know. I just thought I was tired, but it didn't happen in any other session.
Hey,
It was
it's
very confusing,
fascinating.
right? So cool though. My body was giving me signals and I just didn't know what they meant. So
Mhm.
one of the things we can do is get curious, but sometimes I just come in and I'm having a bad day or I'm, you know, whatever's happening. And so it can be hard to decipher, is that me or is that the client? And so sometimes I ask, like I said to that client, hey, are you feeling a little dissociated right now? And they might say, no, I'm feeling really present. And then I say, okay, that must be me,
Okay.
right?
Yeah, so you're being curious about yourself too.
Correct. Correct. Because what we want to simultaneously do, which is very hard, is track their nervous system moment to moment. What state are they in? Are they in sympathetic? Are they in ventral? Are they in dorsal? And what nervous system state am I in?
Mm-hmm.
Yeah. And I want to try to meet them because if I'm in shutdown and they're in sympathetic, it's not going to go very
The
well,
match, yeah.
right?
This is really fascinating because I'm just bringing it back to my work. We have to do this in play therapy. We have to, we call it attunement, right? You have to attune to them. And people are like, oh, it's so fun. You play with kids all day. I'm like, it is actually very exhausting because a lot of the kids that I see are very heightened and I have to meet that energy level, right? And that is a lot of energy that they're putting out. And I get tired after it because for 45 minutes, I'm meeting their energy level. And like then you might have a client right after them. So it does have and I tell this with parents, they're like, I'm getting so frustrated with my own child. And I'm like, well, are you tuning into yourself? What's happening for you? Right. So I do a lot of this work too with parents and interpersonal neurobiology. Like, what's happening for you when your kid does this thing? Right. And sometimes parents are like, oh, like I didn't realize like when my kid is heightened, I'm heightened, or maybe my kid's heightened because I'm heightened, right? Like we do regulate and our nervous systems are seeking input at all times as well too.
Exactly. And part of it might be overriding. I'm not a parent, but I know a lot of parents and I can't speak to how hard it is, but I sure know it looks very hard. And so what happens is I don't even have the time to notice what's happening inside. So
Yes.
it's not that I don't want to, but I feel like I don't have the time. And also there's a lot of language out there. There's a lot of um, messaging, like it's all about your kid. You shouldn't matter. And so that's a lot of stuff that I talk to parents about is because we do sometimes have to override. Like if I really don't feel good and my child is sick, do I just say, you know what? Three,
Sorry.
sorry, I don't feel good. Like I don't feel good. You should figure it out yourself. No, you have to override
Yeah,
how you're
the
feeling.
adult at certain times. Yeah. It's hard. And I do I'm glad that you said that you experience it a lot with parents too, because I mean this is the work that I do and they're just like, or I feel like I Groundhog's Day, I hear this a lot too. Like I'm so just going through the motions where they don't actually get the space or time because life is busy, school, sports, job, cooking, all this stuff. I feel like I don't have the time to ever check in with myself.
Yeah, and what I'll say to that is that it doesn't actually take extra time. It really is intention and mindfulness of even doing it. So when you're driving, you can check in with yourself. When you're sitting in the waiting room, you can check in with yourself. When you're telling your kid it's time to get ready for bed, you can check in with yourself. I'm checking in with myself right as I talk to you right now.
Right.
So yes, I do have to slow down how quickly I'm talking, but that's actually a really powerful skill is to slow down.
Hard.
And it's not that I'm slowing down so much that like, well, now my day's ruined because I'm going from 100 words per minute to 95 or 80. But I think we're not used to doing this.
We're so go,
So
go, 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 go. And our brain's already thinking of the next thing, right? Instead of what's happening right now. It's like, well, I mean, today's Friday that we're talking. It's like, well, what's going to happen it's Saturday and Sunday are not even here yet. But today I was thinking of all the stuff I have to do on Saturday and Sunday. I'm like, I still have so many hours today to do stuff on Friday, right? So, like, our brain's always thinking of the next thing, which makes it difficult to be in the here and now.
totally. And I suffer from this too. I always tell my clients, and I think that also builds trust, like, I am not above this.
Right.
I also struggle. Like, I was in yoga this morning and did the same thing. And so it's how many times can I bring myself back? Can I notice that I'm even doing it?
Yeah. Yeah.
without judgment, without criticism, and just being curious, because the more curious we are, the less of a trauma response we're in.
And I love that we tied it back to curiosity because that's like one of my favorite words is like just approaching things with curiosity. And I think so often we want to have an answer, and sometimes there's not like a black and white answer, and it's nuanced. One thing before we start to I'll give you the last question I always give people, but this work I'm sure can be profound. I'm not going to put words in your mouth, but I'm just assuming I'm all on board with it. What are some outcomes you have seen that show that maybe a client's healing or it's been profound for them?
Yeah, I agree. This work has been profound, and I think any therapy can be profound.
Right.
I'm not a one, like I said, I'm not a one size fits all therapist. So when someone says this is the only therapy, I get a little nervous. I'm talking about this because this is one of my expertise, but
Right.
it's not the only. So I just want to name that. One of the things that I think I notice for people when they're really starting to integrate this work is that they experience more self-compassion
Mm.
without me being like, you need to be more compassionate.
Care, self-care, self-care. It's like you can only say that so many times.
Yes, so that's really nice to see that, not just for me. It's less about me and more about I'm seeing differences in them and they're noticing differences. What I also notice is that people feel like, hey, even though life is hard, because I always say I can't take away that life is going to be hard. They feel like, hey, I can get through it, and I feel more competent and confident
Mhm.
in those hard days or hard moments.
So it's building a lot of self-efficacy too. Like I kid, there are uncomfortable things. Life has uncomfortable times, and I can do this.
Yeah, right. I can. So, ventral vagal, this nervous system state that I've talked about. And if you're not aware of this, that's okay. I wasn't aware of it either. This is
Yeah, it's
something I learned in graduate school. It's called polyvagal theory. So you can look that up. Stephen Porges,
I
Deb Dana.
actually, Sarah, I have to tell you, I met him. I met Stephen Dr. Porges. I was at a play therapy that it was a neuroscience of play. And one of the presenters, he was their mentor. So he came and we did a Q&A. So I always say that when people are into polyvagal, I'm like, I got to meet him. It was incredible.
That's so cool. So yes, we can look up Dr. Stephen Porges or Deb Dana. She's
Mhm.
works really closely with Dr. Porges, and I call her Deb, like we're besties, but we're not. She doesn't know who I always say, I know who she is.
Just
She's
know who
my
you
bestie, but not hers. So yeah, she's a social worker and she really integrates this into social work practice, which I find so helpful because neuroscience is a little bit above my head. But part of the polyvagal theory is this ventral vagal state, which is I can, this sense of I can in our bodies, not just our minds, right? Sometimes my mind
right.
is like, I can, and my body's like,
No,
absolutely
it
not.
can.
Right. So that's when it, rubber meets the road and both feel integrated like I can. And so when we're out of our window of tolerance, it's like I can't. And that's where a lot of clients come to me is I can't. I want to, right? I'm here because I want to, but I can't for various
And
reasons.
that's that I call that for clients, that's that stuckness. Like they feel very stuck. Like I feel like I've been stuck here forever, right? Like or I'm so stuck I'm never gonna get out of it. So I love that you brought that in, that I can. So the $1 million question, it's not really the $1 million question, but the question I'd like to ask everyone to wrap up is, so say someone's hearing about this and they're like, yes, Sarah, this sounds great. How does someone start to, because we know, I hope now it's being taught a little bit more in graduate programs, or maybe you're tuning in and you're like, hey, I've never heard of this, but this is great. Where can people just start to get a basic like level and they're like, hey, this sounds really great? Like, where can people start?
For somatic therapy, somatic experiencing.
Just to get a very baseline of this mind body connection.
Yeah, so traumahealing.org is Peter Levine's website. So, like I said, he's founder, developer of somatic experiencing. Sensory motor psychotherapy is also a different type of somatic therapy by Pat Ogden. So, I think it's sensorimotortherapy.com.org,
I
something.
will find it and send out the link. I know what you're talking about.
Thank you. So I would go to those two resources because those come from the source,
Yep, yep. Not TikTok.
not
There might be,
TikTok.
yeah, there might be tidbits on TikTok, but I always like I something comes up on TikTok and then I do my own. I'm like, oh, let me just dive a little bit more, and some stuff is not accurate. So I'll put those we will put that up with the recording of where people can kind of start, because I think that's even just to like have some knowledge that this exists, and like you can start to poke around at it. And you have to do CEs for licensure for mental health professionals. So if it's something that's interesting, explore it a little bit more. Like that's what's great about continuing education. Like you can explore areas that sound interesting. Does not make you an expert in that area, but it's good to start to gain knowledge in a few different places.
And you can integrate little pieces, even adding in curiosity, even adding in what do you notice inside? What tells you you're hungry?
Signal, right? A signal, a sensation.
Yes. Those are things that are so important, and you don't have to be trained all 3 years to know, or what do you notice in your own nervous system? Those are things we can add right now without having any more education.
Right. And I say that's the place to start. Start with yourself, because you're not going to be good at helping someone else with it if you haven't done the work yourself, which is what you said part of the training was doing the work yourself.
Yes, and a lot of just the 4-day weekends and the 6 days was a lot of our own work too,
Oh.
which is very different than a lot of trainings.
Right. It's not so much, here's the information. It's like experience this and live it and breathe it.
Exactly.
Awesome. Well, thank you, Sarah. This was, we could talk forever. I just put up a few different research pieces if someone wants to, is very into the research world, on some different psychiatric stuff. There's stuff coming out, which is good. That means that trials are happening and controlled studies are happening. So I'd love to, see more and more. I think more and more is going to come out of this as we progress along. But of course, I want to thank you for your time and your expertise. And it's always good to catch up with an old colleague. So I can't believe we've been doing this for so long now that we have expertise in these areas, but we have been. So thank you, Sarah, for your time and your expertise. It was great to have you today.
Thank you so much.
Okay. For those tuning in, you will have to view the recording. You will have to take the test and also complete your evaluation to make sure you get your CE credits. So make sure you do that if you're trying to get your CE. So thank you for tuning in, and we hope that you'll listen to another clinical conversation soon. I hope you enjoyed this continuing education course from Agents of Change. Want to earn your CE credits for this course? Visit agentsofchangetraining.com or the link in the description to purchase the course and take the post-test. If you're looking for more CEs, check out our unlimited plan. You will get unlimited access to 150 plus ASWB and NBCC approved continuing education courses for one low annual fee. We're always adding new courses. Did I mention we also have 5 free CE credits available too? Check it out at agentsofchangetraining.com.